All right, we are live. All right, everybody. Welcome to this interview with Beth Oreo. She is a physical therapist. She specializes in pelvic floor rehab. The reason I asked her if she would so generously give us her expertise today is because as a nurse and as a coach guide, I see so many women who have pelvic floor issues. It's a very common issue. And I actually went and saw her myself yesterday, and we can talk about that a little bit. But I wanted to bring this conversation to light. Just like our elbow, the pelvic floor is part of our body and not anything to be ashamed of. But it seems to be a topic that a lot of us aren't comfortable speaking about. So I thought we would just talk about it today. So thank you for being here, Beth.
You're so welcome. Thank you for having me.
Awesome. So I just want to be transparent. I went to see Beth yesterday because I pee all the time. I pee a lot and I always have. I told her, like, I've always been like this since kindergarten. And so I thought about my future self. And then, like I mentioned, many of my clients have and friends, they have issues with their bladder or peeing too much or frequency incontinence. So I thought, what is going to be my future? Maybe there's something I could do now. So she so generously helped me with that. What is something that, like, your tips for somebody who, like, some of the things you educated me on yesterday? Could you share that with the audience?
Sure. There's some really basic tips for bladder health, really, that people just don't know. So a lot of people wind up with problems with their bladder because of their behaviors or because of things that their parents or other adults around them when they're children, advice they're given or interactions that happen that guide them in the wrong way, and habits are formed that they mean well, but they don't realize that it eventually leads to a bad habit. So for instance, people don't have any idea, like, how many times should I be going to the bathroom during the day, or what's normal? How many times is it normal to get up during the night? If you ask the average person on the street, they're like, I have no idea. Is it normal to get up 3 times a night? No, it's not. Now, if you're pregnant, that's a completely different story.
Not unacceptable.
Yeah. So, but no, it's getting up during the night, 0 to 1 time. So that's
I
it.
gotta tell you, I didn't wake up and go pee last night.
All
I
right.
really drink after 7 PM and I
There
did
you
not get up. I
go.
had a solid night's
Yeah.
sleep.
So,
Wow, that was quick.
right. So, and how long is it during the day? Like, how long should you not be going, And so the normal interval between trips to the bathroom to urinate is 2 to 4 hours. So you don't really want to be going earlier than 2 hours, and you don't want to be going longer than 4 hours. If you're going more frequently than 2 hours, you're teaching your bladder to become more sensitive to those little stretch receptors that are in the bladder that stretch as it fills. You're making them more sensitive. So then it's talking to you earlier, it's talking to you louder, and it's telling you that it's really full when it's not. So it's basically, you're teaching it to give you false alarms. And then you're going to the bathroom. Now you're going every hour. Now you're going every half hour. Now you're going every 15 minutes because it keeps moving that time. Your bladder's going, well, I guess she wants to go all the time, or he wants to go all the time. So it starts talking earlier and earlier. And then the opposite is true on the other end. So if you're typically, this is nurses, teachers, and police officers, people who can't leave their job. They can't just walk away. A kindergarten teacher can't just walk out of the room and go down the hall to the bathroom. She can't leave those students. So she has to get somebody to cover for her. And that isn't always the easiest thing. So, kindergarten teachers or teachers in general, they wind up having to hold their bladder longer and longer, as do nurses, as do police officers. They can't just walk off whenever they want. So what happens is your bladder's stretching and stretching, getting fuller and fuller, and it's saying, hey, we gotta go, we gotta go, we gotta go. And you're like, I can't go. So you keep ignoring it and ignoring it. Well, just like anything else, if you ignore something, it stops talking to you. And so then it stretches and it stretches, and your bladder is just a little muscular storage compartment. And so with muscles muscle fibers stretch and retract. So when they're really, really stretched out far, they can't contract very well. The same thing as if they're too short, muscles that are too tight, they also can't contract very well. So if you overstretch your bladder, those little sensory organs in the tissues that tell you when your bladder is full, they get overstretched, the muscle gets overstretched, and it stops talking to you. It says, well, he or she's not listening to me anymore, so I'm just going to stop talking. And it stops talking to you. And then it also is so overstretched that it can't contract to push the urine out when you do go. And those people wind up on catheters.
That makes sense. So is any amount of incontinence normal? Because
No.
some people will say, well, I had a baby, I'm incontinent sometimes. I
No.
pee when I laugh, or if I jump, I pee, or I'm 60, I pee myself some. Like that's normal. That happens.
Nope.
It's not normal.
Nope, it's a cultural falsehood that we've been sold, especially women, basically women. Oh, you've had a baby. Oh, you're old. Oh, this, that, it's normal to pee your pants. It's, it supports that industry that sells very expensive pads and diapers for, adult diapers and incontinence pads, which are very expensive, by the way. They really add up to a lot of money. If anyone's had to buy those on a regular, continuous basis, they are expensive, more expensive than menstrual pads, because you're using them every day, all the time, if you're leaking quite a bit. And it's never normal to leak urine, never.
Okay, so you would say if somebody's leaking urine, they should definitely go to a pelvic floor specialist.
Yeah, it's not normal, and it can be fixed.
Okay.
Yeah.
If somebody, let's say, so you mentioned something about a lot of people, there's people think that they have to go to the doctor first and get a referral to go to a physical therapist, and they can self-seek the physical therapist on their own. Can you speak more into that?
Yeah, so every state has a different practice act, which is the law that governs a profession. So there's a practice act for nursing, there's a practice act for physical therapy, one for medical doctors, et cetera. So the practice act for physical therapy, you do not need a referral from a physician or any medical practitioner to go seek care. And physical therapists are trained to be able to screen the patient for any kind of red flag that would warrant an evaluation by a physician. So anything that was outside our scope of practice, basically. So
Can you order
most
exams?
patients, do come on their own. Most of my patients don't have a physician referral.
Okay. Are you able to order like a CAT scan or any kind of radiation?
No.
Then you refer them to back to
Yeah.
a doctor if they need
Yeah.
something like that.
Yeah.
But you have the education and the skill that
Yeah, and I do refer a lot of patients out. I work closely with a physician in West Palm who's a physiatrist who treats nothing but pelvic pain. That's what she specializes in. And so my pelvic pain patients whose pelvic floors are really tight and in spasm, sometimes they need a little bit of extra intervention besides just pelvic floor therapy, physical therapy. They benefit from like a trigger point injection that you might get in a spasm, like in any other part of your body. She can do them in the pelvic floor, which is a very specialized intervention that other doctors don't know how to do. If you went to, say an anesthesiologist who does injections for pain management, they'd be like, I don't do the pelvic floor. Maybe some do, but I don't know of any around here that do.
Okay.
That I'm aware of. And like I said, maybe there are, but I'm not aware of any that do. And it's not something an orthopedist would do. It's not something that a regular gynecologist would know how to do. So that can be super, super beneficial. And so, but only a pelvic floor therapist is going to know how to screen for those patients generally.
What are the most common causes of pelvic floor pain? Is there like a top 3 to 5 things that you see?
It's hard to say. It's one of those things that you don't know what comes first, the chicken or the egg. So it tends to be things that go together. Some people, stress plays a big role.
Yeah.
I don't have any.
There's a role in everything.
Yeah, I don't have any pelvic floor patients. I've never seen a pelvic floor patient who's a pelvic pain patient, come in and say, oh, I have just the most relaxing job. I have such a great boss and I have just such a chill job and I have just a chill, relaxed life. That I've never seen. Those patients always are, they always have a lot of stress. They're either internally stressed, people who internalize stress and are just a very type A driven person who, just don't process stress well, or they just have a lot of stress. They have terrible jobs and terrible bosses, and they've got, they're managing elderly parents and teenage children, and they're, and then they've got financial stuff and they have a terrible job, and, just those caught in that kind of life cycle, or other stress, they're dealing with, a sick spouse, or, a sick child or something, and just that stress. And so like one term that I've seen used is, if you have a muscle tension headache and you're, when you get really stressed, you get like this. So they call it a headache in the pelvis. It's kind of like the same thing.
Okay. Oh,
Yeah.
wow. Okay.
Yeah. To give it, an example. So, and also it can be any kind of trauma someone could suffer. So it doesn't, a lot of times people think it has to be like just like a rape, but that certainly is a problem and will create tension and pain and can hinder someone from being able to have sexual relations and penetrative sex without the pelvic floor, reacting in a negative way. But it doesn't have to just be that. It's not limited to just that. It can be just a bad first sexual experience. It could be a bad experience with a gynecological exam. It could be any number of things, and it could, anything that you associate. It could be a very strict religious upbringing that creates a lot of shame around sexuality, or shame around female genitalia and the whole sin and sexuality. And then you're supposed to stay pure, and then you're supposed to get married, and then you're supposed to have sex. There's conflict, that doesn't make sense. And so that can create a lot of problems. And then a lot of times those women have pain with intercourse because they can't relax, because they've been sent these conflicting messages about sexuality.
So
So
we're
there's
talking
a
about
lot
this, because
there.
like you said, like we talk about, oh, I have a headache, like that's mainstream. I could tell most
Right.
people won't mention that to anybody, but I would imagine if you're walking around with pelvic floor pain, that could be something that a lot, like you, all those things you just stated are also like hindrance and actually even sharing that with anyone. So I'm glad that you like brought that out. And if anybody is suffering from these symptoms, I just really hope you heard Beth, and that this is a thing that, people go through, and that there is an answer, right? You don't have to suffer alone, and you're not
Most
alone.
patients, they go through, especially pelvic pain patients, they suffer an average of 2 years, go through like 5 doctors, and are told before they get to pelvic floor therapy, and are told everything from it's all in your head to you need surgery, just all sorts
Right,
of
straight to surgery. Yeah, I see that. I hear
all
that a lot
across the
too.
board, solutions that are in no way even related to each other. And so by the time they get to pelvic floor therapy, they've just been told all sorts of nonsense and things. And, and then before they get appropriate care, there's just such poorly understood and just poor
And that
mismanagement.
could be, even further traumatic, right? You go through
Yes.
five,
Yeah.
doctors, and you're seeking answers, and then you're told
Yes.
it's all in your head, and
100%.
you're like, is it all in my head, or is
Is
there
it me? Am I causing
physical?
am I making my own problem? And they think that they're alone. They think that they're the only person who's ever had this problem. So therefore it must be them. There must be something wrong with them.
There's
And
support groups, right?
yeah, and then they get to pelvic floor therapy, and the therapist is like, oh no, I've seen this a million times, that you're not alone. But they don't know that, they just
Right, and
don't.
you're a specialist in this area. Like
Right.
somebody else is not going to know what to look for if they examine
Right.
somebody with these issues. Like
Right.
that's not something that they're specialized in.
Yeah.
So in the hospital, sometimes I would see patients with, whenever I'd like do a Foley catheter insertion, with a prolapsed uterus.
Mhm.
What is that like? What is that about? How does that happen?
So
Usually
that prolapse, any kind of organ prolapse, is basically, just in very simple terms, a twofold problem. It's a pelvic floor weakness, but the root causes weakness and pressure management. So
Okay.
the pressure above has to, being like up here by your diaphragm, has to be less than the pressure below, meaning your pelvic floor. So your pelvic floor has to be able to have more pressure going upward than the pressure above, which is pushing downward. And for lots of reasons, that gets off track. Your diaphragm and your pelvic floor are supposed to be able to work together to maintain your intra-abdominal pressure. And when that's not working, then your diaphragm is always pushing down. Well, should be always pushing down for you to breathe. And you shouldn't be breath holding. But things throw it off. People that are constipated, constantly bearing
You
down.
mentioned that yesterday, right? If you have bowel issues, more than likely there's something
Right,
going on
right. So
bladder,
you're doing a
vice versa.
Valsalva and you're pushing down, bearing down to try and force out a bowel movement. You're also forcing out your pelvic organs. You're pushing your bladder out, you're pushing your uterus out, you're pushing your rectum out. You're pushing everything else out with it. So that's toiling technique is very, in our diet, the American diet is garbage. We have, very little fiber, and people either drink too much fluid or too little fluid. So if you have very little fiber and very little fluid, you're going to be constipated. And if you're constipated, you're going to be pushing out your stool really hard, and you're going to be pushing your organs out with it.
Yeah, and you think about that over time. 20,
Yeah,
30,
and over time,
40,
that's what
50
happens.
years, 60 years, like that.
Yeah, and pregnancy places all women at risk for pelvic organ prolapse, whether you have a C-section or deliver vaginally, doesn't matter.
You see a lot of pregnant patients.
Yeah, so women who think, well, I'm going to have a C-section, so everything stays, up there nice and tight. No.
You still have all that
That's how it
pressure.
works. Yeah, you forget that for 10 months you carried around all that downward pressure. Didn't really help you out.
Still has an effect.
Yeah,
It definitely does.
doesn't really protect you at all.
And then for the guys out there, what kind of things does a pelvic floor specialist do with?
So men have a lot of the same problems as women. They have pelvic pain, so the same muscle tension issues. And theirs oftentimes can be driven by the prostate getting irritated. So anything that clamps on the urethra is going to cause bladder problems or symptoms. And so if the pelvic floor is irritated or the prostate is irritated and it's bothering that urethra, then you're going to have bladder symptoms. You're going to have urgency. You're going to have frequency. You're going to have burning. You're going to have UTI symptoms, even though there's no UTI. So a lot of men are with antibiotics when they don't have a UTI. They just have a hypertonic pelvic floor. If they have a enlarged prostate, and then for some reason they have a surgery for just anything, and they put in a Foley, sometimes they take that Foley catheter out, and guess what? They can't urinate now. And then, so that's a bit of a pickle. Nobody wants to find out that, you had shoulder surgery, now you're stuck with a catheter, So
you can help people in those situations. So.
Yeah. Because it's the pelvic floor that's now irritated, and because the prostate is irritated and urethra is irritated, and it just becomes like a cycle. And so you start with the pelvic floor. If you get that calmed down, it's like a domino effect. Calm everything down and get that going again. And then of course men, same thing. They can have all the urinary problems that women can have with frequency, urgency, leaking, same constipation, diarrhea, and anybody who's had any kind of cancer in that region, colon cancer, uterine cancer, prostate cancer, anything, whether they were treated just surgically or treated with radiation, those things, they need pelvic floor therapy. And a lot of times they don't get it. I've had male patients who've had prostatectomies, and their surgeons, the urologists that follow up are better about referring to pelvic floor therapy than the surgeons.
That's not automatically going to be something that people
No, some are very good and refer automatically, and others are like, I had one patient whose surgeon told him he wanted to come to therapy. He was leaking just like a faucet, after his surgery. And he was a younger guy, he was only in his early 50s. And, he's still working. And his surgeon said, I'll refer you if you're still leaking in a year. In a
Wow.
year. And so actually another one of his doctors referred him. And within 8
And that's the thing, we don't need a referral. So yeah, we've said it already.
Although
but-
he thought he really did. And within 6 weeks, he was 80% dry. So
Wow.
why wait a whole year? That's
Right, because that affects your quality of life so much.
Oh, for sure. Yeah. And,
much
makes you
anxiety,
stressed, to
yeah.
have such a big life change, and, yeah. And the same thing with, anytime there's radiation in that area, lay people don't understand the damage that radiation does to tissues. And that's damage that it's the gift that keeps on giving. So the radiation, the damage that happens right then, at the time of radiation is not the damage that's to come. So let's say somebody has cervical, they have cervical cancer, uterine cancer, and they have a hysterectomy, and let's say they have to have radiation. Well, what happens is they're at risk for getting vaginal stenosis, where the vaginal canal is just going to close down. So we do dilator training to keep the vaginal canal open. And but that is a lifelong process, because over time, as that person ages, the radiated tissue is more likely to keep shrinking. But a lot of times this whole process of the surgery, the radiation, the whole thing can just be like so stressful to people that then maybe they don't want to do the whole dilator training, and you don't know, like, it's so emotionally traumatizing. But if you don't, I've seen patients that, their surgery was, 15 years ago, and they didn't do their dilator training. And now, I can't get this finger in their vaginal canal. It's so close.
Is dilator training something that would be normally, it might not even normally be something that they even know about, or is it something?
No, they're oncologists. Tell them right away, you have to, start doing this as soon as the.
Okay. So people are in this situation and they're thinking,
yeah, but I've seen people not
deal with one more thing. They really need to deal with it now.
They have to do it. Yeah. But sometimes people they either, because of the emotional trauma that, or they don't realize, they don't understand that it's you have to keep doing it long term, and because they can't see, and maybe their spouse passed away and they didn't realize, they're not having intercourse, and then then they go to have a medical exam, they're like, we can't even
see.
Yeah.
Okay. And I would imagine you see people who have difficulties having sex as well. Is that?
Yes, that's the whole, basically everybody from perimenopause to postmenopause. That whole group. Yes, that whole group. I mean, it can start in the late 30s, or even women who are breastfeeding, because that changes your hormones, and it makes your body kind of think you're, like your body doesn't want to get pregnant while you're already breastfeeding a child. So it kind of shuts things down hormone wise. So there's a lot of vaginal dryness, and there's a lot of, pain with intercourse oftentimes. Some people, they're fine. Other people, everybody's different. But, perimenopausal changes for some people can start in their late 30s, but very often mid 40s, and definitely by the time someone's in their 50s, for sure. Some people skate right through, they have minimal symptoms. Other people are like, their lives are just, marriages end over it. It's really can be devastating, and women can be in just, a lot of pain. And I have women come in and they're like, I haven't had sex for 2 years with my husband. It's so painful. And, and it becomes one of those snowball issues, and I always say, well, if I come up and I poke you in the eye, if I poke you in the eye once, you're going to go like this. But the second time I come up to you like this, you're just going to go like that. Right? So that happens with your pelvic floor. One time that penis comes in and it's painful. It's like, okay. Second time, it's like, no, you're out. Get out.
I'm done. Yeah.
Not coming in. Goodbye. And that just becomes a and then if you keep trying, the more you try and have sex, the more painful it is, the more those muscles just close down and they're like,
Right, then you have the psychological and emotional pressure, and it's like,
yeah, and then the way it impacts the relationship, and it makes you feel you don't have control over your own body, and it's really,
so in those situations, there's ways though that you can
oh yeah,
work with
oh yeah,
women and help
yep,
them.
yep, that's also something that can be corrected.
And then men, you see men have painful intercourse? Is that something that men
Yeah,
complain
because if their pelvic, so the pelvic floor is responsible for orgasm. So if it's in spasm, it can prevent you from having an orgasm, or it can make orgasm very painful, or painful afterwards,
about?
so it can
Okay.
so it can just wreak havoc if it's not working right.
Is there any other thing that we didn't cover that you like, patients that come in that you see?
Yeah, so I see some pregnant women just preventative and prepartum, postpartum, which, in other countries like in Europe, pelvic floor therapy is standard care for pregnant women and postpartum. Because, why should we just wait for our, pregnancy and delivery is very traumatic on the pelvic floor. So, but in this country, it's like, no, we're not going to help you until things start falling out, until you're urinating down your leg. We're not going to do anything for you until then, but that's our screwed up way of doing healthcare in this
Yeah,
country.
it doesn't have to be that way.
Right. So I do get, but the mindset of the consumer, because we've become more of a consumer healthcare kind of mentality now, is that, women are starting to say, hey, you know what? I'm going to take care of myself. I'm going to go and just go see a pelvic floor therapist before I have a baby.
That's what I did. I'm not planning on having a baby, but I was just like,
Right.
my future self is going to be
Right. I'm going to take care
Is
of
there
myself.
anything I can do?
I'm going to get my
Yeah.
pelvic floor ready for delivery. And then afterwards, I'm going to go see one to make sure that I heal well and I get everything, healing up, and not that I'm not doing things unintentionally that could be making me not heal well or developing bad habits and things like that. And, and I had a patient who just scheduled who had a C-section, and she had like I think her first delivery was really difficult, and she had some problems afterwards, didn't have any care, any pelvic floor therapy. So this time she was like, I'm going to get, and so she asked the doctor who delivered the baby to the C-section, she said, I'd like a referral to pelvic floor therapy. And she said, he looked at her like she had 12 heads. Why would you need a referral? Why would you want to go to pelvic floor therapy? She was like, just got a baby out of me, and I just pregnant. Why would I, she's, but that's our mainstream medicine.
So yeah, it's so important to advocate for yourself. But then there is that, if you don't even know like that it's a problem, right? If you don't even know that it's not normal, because honestly, I think that a lot of women think that some incontinence, especially at least some stress incontinence, is totally normal. Then we don't even know to even look for answers. So I think that's so important to advocate for ourselves and to have these conversations.
Yes, 100%.
You and I were talking about it's just another part of our body, but for all, cultural, religious, traumatic. There's so many reasons why we just don't talk about it. But the more we talk about it, the more I think people can come out of, the suffering that they're experiencing. And
yeah, absolutely. Because it's a part of women's bodies that they don't even know, because they can't see it, and, externally, nobody can see the inside of their pelvic floor. But but the outside is part of your pelvic floor as well. It's muscle. And, women should grab a mirror and get familiar with like what's normal for you,
Yeah, because I've seen people who have kids growing in the hospital, and by that point they need surgical intervention, but have they used a mirror or, been more had that body awareness,
right,
then they would know that, oh wait, there's something growing there.
Most women who have, like, let's say, a pelvic organ prolapse, like a cystocele, the first time they realize they have it is when they're showering, and they can feel it just at the entrance to the vagina, and they think they have a tumor. They think they're going to die, because they don't know anything about it. and doctors don't assess for it, you know? So, it has to be assessed. You have to bear down to check to see if someone has it, because when you're laying down and you're not against gravity, it's
Right,
not
it's
going
not
to be
gonna come
there. It's
out.
generally not going to
So
show.
for that, what would be a good like self-exam for women to,
There's not really a
there's
self-exam.
not,
It's someone
okay,
has to do it. Yeah,
okay.
yeah.
But if somebody was to feel that, oh, there's something hanging out, then that's like, they need
They
to go
should
to
see
a
it. They should see an
specialist.
OB/GYN for that.
Yeah.
Yeah, for
It's
sure.
not normal and it needs
Yeah,
to be.
because they're not going to know, oh, is that a cystocele or is that something that doesn't belong there?
Yeah.
So yeah, that's something that an OB/GYN should check out.
Okay.
Yeah.
Anything else you'd like to share on this topic?
No, just to normalize it more and to make it more, that, like you said, it's just like your elbow. And it's just, yeah, they're just muscles, and it's just another part of the body that just needs, attention. And it's a system that, everybody needs to be more aware of that. And especially women, women's health tends to always go on the back burner. Everybody else is more gets tended to. And women need to be proactive in taking care of their health and their bodies and their well-being.
Right.
Yeah.
Thank you. Yeah, I really think that it's so important that we talk about this. And then it's something else I was gonna say, and I totally went blank on it. It'll
Yeah,
come back to me.
it's
But
it's becoming more well-known and more prevalent. But it's an underutilized service and an underrepresented service. In St. Lucie County, there's almost 400,000 people, and there's two pelvic floor physical therapists. That's it. And Martin County, the same. There's two.
I was gonna say,
That's it.
a friend who were in Martin County just sent me that she has a pelvic floor specialist at her chiropractor office as well. So I'm glad to see that. But that's such a small amount of specialists.
Right. Yeah. It's not something you can come out of school and do. You have to do additional training postgraduate, and you really need a good background in orthopedics before you go. So you need a couple of years of experience as a physical therapist first, and then, specialize in it, because it's just very complicated. Yeah.
Oh, yeah. Just, in the anatomy you showed me yesterday, I'm like, I know I learned this in nursing school to some degree, but it was so helpful to see the pelvic floor again and to like have the bladder and everything explained in the way that you explained it. Even that is so helpful.
That's
Like
why.
so many people don't even know what the
Yeah.
vagina like looks like, or
Right.
where the urethra is, or any of that. And
Yeah.
it's part of our body. It's part of.
Yeah, that's why I feel like it's important to spend that, I set aside 90 minutes for the first visit, because I feel like that education portion is so important. Because how are you supposed to, learn how to heal your body if you don't even know what you're talking about, where these structures are and how they relate to each other, and, how it all works, So I think that's really important to have that understanding, that visualization, and being able to picture in your mind what you're doing and where it all
Yeah,
is.
that's super helpful. Well, thank you so much. And I remember what I was gonna say. I was gonna say, being able to I'm so grateful that I'm able to this is so silly, but almost every morning when I wake up and go pee, I'm like, thank God that my bladder works. Because there's
Yeah.
people, I actually worked with a doctor whose daughter at a young age got in a jet ski accident and ended up with a suprapubic catheter for a while. And so I always think like, wow, what a blessing to have functioning, functioning organs. But even if you are somebody who has, a situation like that, there's still additional support.
Right.
And they work with somebody like you.
Mhm.
It's always something that, other things we can do so that to alleviate our suffering.
For
Well,
sure.
thank you so much. How do people find you? All the local people.
I am on the internet, so just search my name, Elizabeth Oreo, DPT. I will come up pretty quick, or Beth Oreo, DPT, either one. And I have a website, BethOreoDPT.com, and Facebook and Instagram. So I'm kind of all over the place. So pretty easy to find me. And my office is on US 1 in Port St. Lucie.
Perfect. Thank you so much. And if anybody has questions for Beth, just go ahead and drop them in the chat below, and I'll try to make sure she sees them and we get some answers.
Yeah, awesome.
Thank you so much. I really appreciate
you.
you sharing it.
All right, awesome. Thank you.
Expertise. Bye.
Bye.